As far as the study, I mean, obviously PI3 kinase delta inhibitors are an important class of treatment in non-Hodgkin lymphoma. The vast majority of non-Hodgkin lymphomas, specifically B-cell non-Hodgkin lymphomas, have activation of this pathway. So targeting this is a very sort of natural step in sort of trying to improve patient outcomes. To date, a fair number of the treatments have been sort of hampered by adverse events such as transaminitis, colitis, pneumonitis, rash, things of such nature. So the sort of implementation and sort of integration into standard treatment has sort of lagged behind some of the clinical results based on some of the fear of dealing with some of these adverse events. In this study, we looked at a second generation PI3 kinase delta inhibitor, which was designed to have a slightly improved sort of toxicity profile, specifically decrease incidence of transaminitis. Part of this trial, what we were able to see in this situation is that ideally, a fair number of the responses that were noted were early on within the first 8 to 9 weeks of therapy, and most of the significant toxicities that we associate with the PI3 kinase delta inhibitors occurred thereafter. So there was a modification of the protocol after about the 8-week mark to sort of adjust the treatment to give the patients more of a maintenance therapy. So instead of being treated daily, which was a standard practice with the PI3 kinase delta inhibitors, the treatment was transitioned to a once-weekly dosing regimen, after which point we did see some maintenance of response, but we did see a significant decrease in the number of adverse events that we associate with the class, sort of demonstrating that the drug can be given long-term in a very tolerable manner if you do give some sort of break to the patient in regards to the cumulative sort of dosing of the medication. So we think all this really relates to the depletion of T regulatory cells with continuous dosing of PI3 kinase inhibitors, and by giving the body a break, you allow some of these T regs to sort of recover, which prevents some of these sort of autoimmune manifestations that we see that have sort of, again, hindered this integration of this medication into clinical practice. So moving forward, I think most PI3 kinase delta inhibitors, the Insight molecule and others, will look to sort of integrate these maintenance therapies to sort of improve long-term tolerability, and hopefully, we'll have another sort of weapon in our fight against B-cell lymphomas.